Clinical practice, be flexible. Titrate to the kid's behavior. There are no rules. Some kids, I double their dose on weekends. A capful of Miralax Monday through Thursday, 2 capfuls on Friday, Saturday, Sunday. Some kids I only treat on weekends. They just get Miralax on Friday, Saturday, Sunday. Some kids just get X-Lax on Friday and Saturday. That's it. They don't get anything during the week. They don't want anything during the week. This is really important. Consider prospective cleanouts before a special event, AKA Disney World. They're going to go to Disney World. They're running around the Magic Kingdom. The kids aren't running to the bathroom. They all get backed up. I get calls from Cinderella's castle. I'm here at Disney World, $600 a day. My kid's crying. What am I going to do? So tell them, double up on their Miralax for the week before they go. Get all clean. Enjoy Disney World or Magic Kingdom, whatever. It's tough, but if you do this right, your patients will be happy and they will feel very empowered. KUBs are useful. You can see when they are working. If you see a kid with constipation, you give a treatment plan. The mother says, I'm doing exactly what you said. He has 10 bowel movements a day. It's not constipation. The belly pain is being caused by something else. Get a follow-up KUB. Say, you think you're doing everything. He says he's having a bowel movement every day, but look, it's just as constipated now as it was before. Remember that we are evidence-based, so we come as physicians and healthcare providers, we sit in a room like this, we read our journals, and we learn all about the intricacies and the elegance of all these randomized trials. Parents don't care about any of that, they just want to make their kid better. So be flexible and titrate and modify your treatment plan for the individual kid. Kids do get better. Remember I told you they get better? They do get better. If you follow them over time, years on end, most of them, 75, 85% of them get better. And if you look at them, lots of them get better off therapy. Look at those green bars. So if you follow them out 8 years after therapy, preponderance of them are not only better, but off therapy. Some of them are still on therapy. There are some kids who don't get better. They don't work at it. The number of kids who really try, parents who really try and don't get better is dismal. But they'll say to me, well, what happens if we don't do anything? I say, well, if you buy your kid a piano and he doesn't practice the piano, does he get any better? And they say, no. And I say, well, if your kid is constipated and you make no effort to make it better, it doesn't get any better. So that's the grim news, but that's a small percentage of patients, and I would wager for that 5 or 10% of patients that there's other stuff going on. Clinical predictors, after age 4, those kids seem to do a bit better. Things related to failure, if they're encopretic, they're harder to treat. Doesn't mean you can't fix them. It just means you have to work a little bit harder. Longer period of symptoms, if they've been constipated for a longer period of time, it's going to take longer to get it better. And boys, because they're developmentally, like me, disabled relative to girls, they are more likely to relapse. So you have to know that they're going to relapse. You just get back on that horse. You keep trying either what worked before or you try something different. But they do get better. What's our summary points? Constipation is common. That should be offset in a different color. It's just common. Recognize it. It impacts significantly on urinary complaints. That's why I'm here today. You got to treat them using medicines, diet, behavioral interventions. They can be treated successfully and will be treated successfully, and you will improve their quality of life more so than fixing a otitis media. And that's about it.